How does casuistry challenge universal ethical principles? Imagine trying to solve a puzzle where each piece looks different and fits in a unique way. That's what casuistry does in ethics. It looks at each case individually instead of relying only on broad rules. In medical ethics, we often talk about principles like autonomy, beneficence, non-maleficence, and justice. These are the foundation of how we decide what's right or wrong. But casuistry questions if these principles always apply the same way in every situation. It suggests that context really matters. For example, a patient refusing treatment for religious reasons might seem wrong if you only think about beneficence. But when you consider their beliefs and life situation, the decision might be different. Casuistry works by comparing the case to other similar cases that are well understood. It uses reasoning based on analogy, meaning it looks at what was done before and applies that to the current situation. This approach doesn't reject universal principles outright. Instead, it asks if they should be applied strictly or with some flexibility. It recognizes that sometimes principles like respecting autonomy might conflict with saving a life. Casuistry encourages healthcare workers to weigh these principles based on the specific details of each case. It promotes practical judgment, which means making decisions that fit the real-life circumstances. For example, when deciding who gets a scarce organ transplant, casuistry helps weigh the individual needs and context rather than just following a fixed rule. It also helps in end-of-life decisions, where respecting a patient's wishes might conflict with other duties. This method invites dialogue, listening to the patient's story, and understanding the moral significance of each detail. It shows that universal rules can be helpful but might not cover every situation. Instead, ethical decisions in healthcare often need to consider the particular facts, history, and context. Casuistry challenges the idea that one-size-fits-all rules are enough. It pushes us to think carefully about each case and adapt our moral reasoning accordingly. This way, healthcare decisions become more responsive and respectful of individual circumstances, making ethics more practical and human-centered.